Welcome to Sword and Shield, the official podcast of the 960th Cyberspace Wing. Join us for insight, knowledge, mentorship, and some fun as we discuss relevant topics in and around our wing. Please understand that the views expressed in this podcast are not necessarily the views of the U.S. Air Force nor the Air Force Reserve, and no endorsement of any particular person or business is ever intended.
Good day, Gladiators. Thank you for listening to another episode of the Sword and Shield podcast. My name is Francis Martinez, Director of Psychological Health for the 960th Cyberspace Wing, and I have two very special guests with me today.
I'm Master Sgt. Pienta. I'm 16th Air Force Mental Health Programs Manager. So essentially what I do is I strategically and operationally manage the Airman Resiliency teams for all of 16th Air Force 10 wings. Just to understand a little bit about what an Airman Resiliency team is, in most layman's terms that I could put it, they are the embedded operational support medics, mental health, religious affairs, et cetera, that provide services in regards to resiliency to our airmen and guardians.
I'm Lieutenant Colonel Emily Rucker. I am an IMA, so Air Force Reservist, to the Surgeon General's Office for 16th Air Force. I'm a clinical psychologist by training, previously active duty psychologist for 14 years with the Air Force, and now support Colonel Kent, the 16th Air Force SG, in whatever he needs regarding mental health.
Yeah, and we have a very good relationship with 16th Air Force. We've done a lot with you guys, and we really appreciate you guys coming out today to record the podcast. And today's topic is going to be mental health. Yay! So May is Mental Health Awareness Month, so it's really important for us to again destigmatize and normalize mental health as a whole. But as you guys know, Air Force Cyber and Cyber Wings, we have 99% of our folks have some sort of clearance, and the fear of seeking mental health is always there because of that whole myth of I'm going to go to mental health, I'm going to lose my clearance, or something's going to happen. The other thing that I always hear is that, well, if I go to mental health, you guys are going to med board me, and how am I going to, live or support my family and insurance and things like that. So those are some of the topics that, I want to kind of talk about today, and have your expertise and kind of debunk some of those myths and kind of talk about what mental health really is and what it's not. I know Sergeant Pienta and I were talking earlier that I see active duty patients at Wolford Hall as part of the clinical role that I do, and most people that I see generally don't have a diagnosable disorder, right? It's like we all know that when we're talking about mental health diagnoses, like major depressive disorder, bipolar disorder, generalized anxiety, there's very strategic or specific criteria that has to be met in order to be diagnosed with something, right? Just because you have a problem, like, hey, I'm having work-related stressors or trouble with my spouse or my kids, doesn't necessarily mean you have a mental health disorder. You want to talk a little bit about that?
Correct, absolutely. And I can speak to, I was worked in clinics for 3 of my assignments, so various MAGCOMs, various bases, and I would say 98% of the people I saw, were coming in with symptoms that were troublesome at that time, but were situationally based. They weren't necessarily severe problems that would qualify for a mental health diagnosis, a long-term mental health diagnosis. Most of the time, it's adjustment to a situation that's going on at the present time, and they are benefiting from just a couple of sessions with a provider just to help them look at different coping skills that they could utilize, and then they take that and run with it, and they don't need our assistance anymore.
Yeah.
It is quite rare I would say, particularly for military members in general, to have a severe mental illness. It's just we're an overall generally healthy population. Doesn't mean people don't have troubles here
Right.
and there, but really quite a healthy population.
And most diagnoses are either they can be exacerbated by situations, right? Like we're going to talk about PTSD. We all know trauma, combat-related trauma that folks have experienced, and so it's how our body processes trauma is how we have different symptoms or triggers or things like that. So I think that's something that people kind of assume everyone that has been to downrange or different places have severe trauma, which really isn't the case, because situations can happen. All three of us in this room, right, same thing, we all experience it differently, and our brains processes things differently. And so just because we all experience the same thing doesn't mean we're all going to be affected the same way.
So if I could speak to, just in general terms, a lot of people will come up to me and ask me, leadership-wise, how do I know if one of my airmen needs to go and seek mental health treatment? And usually what I try to explain to them in the most basic layman's terms is, if you are having trouble functioning in one of maybe 5, 6, 7 different categories in your daily life, your daily routine, whether that be if whatever you're dealing with is affecting you occupationally, like you're showing up late to work, you're not able to produce at work, you're not as effective at work, if you're having trouble interpersonally with your relationships, if you're no longer okay in that relationship, or you're not able to do the same things that you were before, you're not having fun leisurely, you're not actually getting out and doing the same things that you were before. Just basic functioning in life is, if you realize that after a few weeks you are just not functioning on the level that you were previously, then yeah, you should probably go and seek mental health treatment. But I think where people get caught up is that mental health is not your only avenue. Mm-hmm. There are a lot of resiliency-based treatment options that you can go and seek out before you get to that echelon of care. And I think once automatically somebody is dealing with something, they automatically assume that they have to go and seek mental health treatment because of the name, the umbrella. But, there's Military One Source, there's your MFLAC, there is the chaplain. And the chaplain doesn't only do religious-based coaching or counseling. They'll talk to you about anything, and it doesn't even have to be religious-based. You can contact any program out there, and they're going to get you to the right spot. And rarely does anybody reach the level. When I say rarely, I mean, like Colonel Rucker said, 98% of the people probably don't reach that clinical threshold. And they just need something to get them through the current situation that they're in, and then that's it. And I think that's really the defining factor, is just making sure that you are continuously getting the resiliency help that you need, the preventative maintenance for your mental health, and then kind of, if it gets to a point where your functioning is affected, then you can seek, mental
Right.
health treatment.
So the reserve wings, they have the DPHs, right? The Director of Psychological Health. So here, I always advocate and promote, let me be your first stop, right? And if I feel like we need to do something a little bit more progressive than what I can provide, then we will go to the mental health clinic, or get you a referral to an appropriate provider. But generally speaking, last month I saw 185 individuals, so 185 individual sessions, and one only needed to go to further treatment. And so most of the staff that people are dealing with, especially coming out of COVID and readjusting to you know, we're out of telework for our wing, right? And I know a lot of people are having some challenges coming back, and like, what does that look like? I've been teleworking for 2 years and having to readjust home life and work life, so a lot of those transitions. But we also did see that during teleworking days that we did have higher levels of relationship stressors, occupational stressors, just because of that whole work-life balance, or being at home with our partners 24/7.
I think a lot of people are right now reestablishing their new routines, that new outside of the home routines, right? And even then, right, recognizing that it may not go back to exactly what the routine was before the pandemic, because things have changed. Even though we're somewhat going back to there aren't restrictions as there were, it doesn't mean that things will be exactly the same. And so just being patient with that and understanding, it'll take a minute to establish a routine, and actually it's an opportunity to maybe establish a new routine that you didn't do before, or make some space for something. But yeah, I do think that's difficult for people a lot of times, because we like predictability and we like control, and so it's a little bit unpredictable right now in terms of, are things going to be exactly how they were or not? And so just reassuring yourself that, hey, if I need help, or if I have any question, I'm sure just coming to you and even saying, can I just consult with you about what my options are? Here's what I think's going on, or here's what I'm having trouble with. What are my options, and dealing with that.
I think the other part is that sometimes someone just needs to vent to someone, right? And so I have a very open door policy, and so I joke with Colonel Esland, he's the group commander here. He's like, you're never available. And I'm like, I'm always available. That's why I'm never available, because my door's always open, so someone's always stops in for a 5-minute, like, and then, is able to get up and move on about their day. And so I don't consider that a mental health episode, right? It's just challenges that we're all facing. And sometimes that little bit of decompression just to kind of reset, or have another set of eyes and ears to, okay, let's really break this down, and what are you really faced with, right? Because our emotions do get the best of us sometimes, and we can't sometimes think clearly when we are, our feelings are involved, and sometimes we just need to look at the facts, right, and kind of break it down that way. So we have a better understanding of what's going on and how to move forward, right? Again, it's not a mental health disorder.
And I know you had mentioned that one of the big topics for people and concerns, again, seeking assistance, is their security clearance and how that's going to be affected. And so, one of those things, having run a couple of clinics, I will say, so in the 14 years that I was active duty, I had never removed someone's clearance or recommended suspension as a provider. More often than not, by the time people came to see me or see one of the providers in the clinics, their clearance was actually already suspended because of maybe things that had happened. And so
criminal, financial, other stuff.
There were already issues going on, and it was already suspended, and they're coming to seek assistance was almost a result of the, hey, this is already going on, and now I'm coming to talk to you. As a provider, the big thing we're looking for is judgment and reliability. Mm-hmm. So if you're demonstrating good judgment and you're demonstrating reliability, there is no concern about your clearance whatsoever from a mental health perspective. Seeking assistance when you're having trouble is a sign of good judgment. It is a sign of reliability that you're seeking out assistance when you know something's going on. And it is very rare for a provider to recommend suspension. There has to be actions or behaviors suggesting someone is increasing their vulnerability to exploitation or unable, potentially compromising information that we would even then reach out. There are a few occasions where it does automatically, the clearance maybe automatically gets suspended temporarily by the security officer until we get to see someone. So like if you go for inpatient treatment for mental health or hospitalized, in my experience, generally the security officer automatically suspends the clearance until you get discharged and mental health has a chance to meet with you to determine if you're stable and what have you, and then generally it can get reinstated, assuming that's the case. That's a rare occasion, and it's pretty specific, but otherwise I've also done evaluations for people where it has already been suspended and they're looking to get it reinstated, and again we look at judgment and reliability, and so if there's other specific concerns people have, I always encourage them. They can call the mental health clinic and say, hey, I'd like to just talk to someone and get some questions answered, or come and speak to you and say, I have questions, and come in with a hypothetical, right? And say, if this, how might that affect it? I would much rather, as a provider, answer people's questions up front, and then give them the opportunity to decide how they're going to pursue assistance versus them not ever even trying because they're afraid of what might happen.
I always try to be as transparent as possible. Like, look, coming in here talking about certain things, this is what we're going to have to do, right? If a suicidal person walks in, then it's going to be very different than the person that just sits in here and invents to me, right? We're going to have to talk to certain people and get the appropriate help, which could lead to hospitalization. But anytime anyone comes to me and it starts going down a certain path, I have that conversation with them, like, okay, let's, I'm gonna let you know this is what we're looking at here. But we've talked about the whole clearance. I think it was like 2 million clearances were adjudicated.
It's like 12 or...
And only 12 were
12
denied.
of them were denied for mental health reasons only. That's a tenth of a percent. That's less than 1%, but that's less than 10% of 1%. And so
it was like .005
exactly.
or something.
And the myth, wherever it comes from, is not founded at all, based on that evidence. But I'd like to speak on including what Colonel Rucker said about seeking treatment, help-seeking behavior. Getting help early and often is almost always, if not always, better than not getting any help at all. That includes, when we're talking about reliability and judgment in terms of your security clearance, but also for medical evaluation boards. I kind of put it like this to some people: if you were running around with a broken leg or a broken ankle, and somebody said, "Hey, if you keep running around on that broken ankle, you're probably not going to be able to run for very long." Oftentimes, people don't equate medical issues with mental health issues, but they're kind of one and the same. If you're running around, it would look kind of crazy if you're running around on this broken ankle and you just kept running around on it and didn't get it fixed. That kind of questions your reliability and judgment, and you're probably going to get med boarded for it. Same thing, same rules apply for mental health. If you wait too long, things can manifest, things can get better, things can, or worse, and you may wind up on the wrong side. And so if you don't go and get treatment, your mental health symptoms can persist and get worse. And so just think about it in terms of, the most rational, logical thing that you can think of. Would you run on a broken leg? Most likely not. So why are you going to allow your mental health symptoms to persist without any treatment?
And continuing on that, with regards to med boards, the military has a responsibility to rehabilitate you. So that is our job in the mental health world, in the medical world, is if you're having trouble, we are responsible for trying to help rehabilitate or help you with treatment. And so it is a rare occasion that you would come in and automatically a med board would happen without any sort of treatment. So most mental health conditions are treatable, and what I often tell people is, really, unless it's extremely severe, I usually estimate about a year, right? Because it can take a year to deal with things and to work on things before we would even consider that. I mean, it would have to be pretty severe to even consider a med board before that. There are a few diagnoses that if you have that diagnosis, it automatically requires a RILO, or report in lieu of a med board. But even those, more often than not, it's a return to duty. But med boards occur if your condition is significantly severe that it precludes you from being able to perform your duty. So if you can still do your job, and you're able to do your job, you're able to deploy, you're able to fulfill your requirements of your position, we aren't looking at a med board yet. Even if there's a temporary period where you can't do that, we still aren't looking at a med board yet. That'd be a prolonged period where that would be the case. So again, speaking to that coming in and getting treatment, or even this extends to medication as well. Medication may put you on a profile for a brief period of time, but unless it's some very specific types of medication, which would go with some very specific types of mental illness, we're not going to look at a med board for a while.
Right.
We're going to focus on working with you and treating you.
And I think to round up there, just so people have an understanding, about 1 in 5 people suffer from a mental health disorder, right? So militarily speaking, that's a lot of people, right? And so I know that, the mental health clinics are flooded, sometimes longer wait times because people are going to seek treatment. And I myself, as a provider, have not med boarded or recommended med board for anyone. Same with you, have not recommended pulling someone's clearance. We've had to put people on profile just because of situational things. So we don't feel like they're safe enough to deploy or go TDY. We just want to ensure that they're getting the care that they need until they're more stabilized. And so, we've seen successes even in our wing. Folks that have received treatment and are doing amazing, have never lost their clearance, and so that's they're still here, they're not being med boarded, and so these are all the things that we like to talk about, like really getting in front of things and educating people, because everyone's going to say, oh, don't go seek mental health, right, because you're going to lose your clearance, or they're going to kick you out, right? And so that puts another level of stress on folks.
And I would say those stories you hear about where people had their clearance removed or got kicked out, because I would have people come and tell me that, I would say, understand, you probably don't know the whole story. Right. There may be parts in there that you aren't aware of. That is why that situation happened. And if you're hearing it secondhand or third hand, you definitely probably don't have the whole story. But again, when in doubt, go to your resources, your DPH, call your mental health clinic, ask the question. And if you just say, I want to ask you a hypothetical, we all know that means
I'm asking for a friend.
I'm asking for a friend. And you know what? It's clear up front. This is not a patient-provider relationship, but you are asking a question, because whatever we can do to get those roadblocks out of the way so that you can get help, I think every single one of us would be more than happy to answer whatever questions.
Absolutely.
On that note, just a couple examples of what Colonel Rucker is speaking to is, mental health may have been involved in it, but you allowed it to fester to the point where possibly an administrative action was taken, like you had an alcohol-related incident because you let things get too far, or you had a relationship issue and the first sergeant was called or the police were called, or you had, obviously a domestic dispute or something along those lines. So more than not, those stories end with something that is not mental health related, but may have been caused by not getting the assistance that you needed.
Yeah, and there's a ton of people here to help, and I think that's the important thing. Always reach out to your DPH if you're in a reserve wing. If not, you have your shirts, your leadership teams, your supervisors, and then obviously the mental health clinics, MFLACs, Airmen and Family Readiness, chaplains. There's a plethora of resources available to support you, and that's what we're all here to do. So Thank you guys for joining me today. I appreciate you coming all the way from Washington State
Thanks
just
for
for the
having
podcast.
Yeah, thanks for having us.
Yeah,
Appreciate it.
and you just coming around, down from Lackland. So I
Yes, ma'am.
appreciate
Yes,
that.
ma'am.
But to our listeners, if you or someone you know are contemplating suicide, please contact the National Suicide Hotline at 800-273-8255. And in July, there's going to be the 988 number. So that goes live in July. So we're really excited about that. So thank you guys again for joining us. And Gladiators out.